A new year means there are also new babies. We take you to the Dr. George Mukhari Hospital in Ga-Rankuwa. That's where the Health MEC of Gauteng, Nomantu Nkomo-Ralehoko, is handing out presents to mothers who have just given birth. Nqobile Madlala is there, and you're standing by, Nqobile, to tell us about why else the health department is there, more so when it comes to immunization.
Yes, that's right, Dudu. There's a lot that the MEC has spoken about, including making sure that the kids or the babies that have been welcomed are healthy, as well as the mothers as well. That's, of course, becoming very important, that they immunize going forward. But I want to bring in the doctor that has been working here for quite some time. And, Doc, I want to start from here. We know that you've welcomed quite a number of babies yesterday, but I mean last night, today, coming to today. But I want to know, for as long as you've been here, how many babies have you welcomed?
More than 100,000.
And how's it different this time round?
At the moment, I think it's just the coordination with the local clinics and the lower levels of care in order to make sure that we attend to high-risk patients.
And do you have any of those high-risk patients?
We now concentrate only on high-risk patients, but I need to thank the other levels of care that are cooperative, in the sense that if we have a low-risk patient, they are able to accept that patient and they refer a high-risk patient to us.
All right. Thank you very much for speaking to us. And, of course, the MEC is here, Dudu, and I'm just going to ask her to step forward for us so we can see her. MEC, we saw you giving out those hampers to quite excited mothers as well. Quite a beautiful moment today it is.
It is a beautiful moment indeed, because we have the mothers that are here, and this time around it is 3 boys and 3 girls that we received when we're doing the crossover, and I'm excited about that. You know, I always want to balance the gender. I want more girls to be here in this earth so that they can take full responsibility, because I perceive that women do better than boys, even in school. But another thing that we've been doing is just to talk to them about the issues of immunization of their children, because they need to know that that child must take full responsibility. There is a Road to Health document that we give them, working with the Department of Education, because it's an integrated approach again that we are doing. But we need now to educate our communities about our children. We need to go back to basics, because we can't have young children that are giving babies. Even here, we have a 17-year-old and an 18-year-old. Definitely those people are still young, according to us as families. So we need that emphasis in our communities. It's something that we'll have to take it up as public representatives in ensuring that we protect our girl child in our communities.
MEC, have you had a chance maybe to hear about, in terms of the overall numbers that we have in Gauteng at the moment?
At the moment, my team is still collecting the stats. We will give you during the day, as we did last week, the numbers, how many do we have in terms of the boys and the girls. And again, we'll even indicate who are the people that are coming from South Africa and those that are coming from the neighboring countries. Because last week people were just giving numbers that are not correct, which are not true. So we need to correct those perceptions, because once you send a wrong message to the communities, people think that it's correct and it's right. We have seen the people that are here, even in the ward that gave birth to these kids, are coming from South Africa. They are South Africans. So those are the things that we must clarify to the citizens, so that there's not this misconception, thinking that when we have babies, it's not the babies that are coming from our own children as South Africans.
And documentation, you talk about South Africans. Documentation, how important is it for these mothers to document these babies immediately?
It's very important. That's why as a department we have partnership with Home Affairs. We have seen the offices here. In every hospital we have an office of Home Affairs. Immediately they get their birth certificates, which is something that we really appreciate from the Department of Home Affairs, of agreeing to work with us on the first day that that child comes out from the mother.
And of course, whilst we talk about those mothers, you talk about these young mothers becoming a major issue, that we have teenagers that are having babies. Why is this such a huge issue?
It's a huge issue because of the society where we stay. That's why I'm saying we need to go back and talk to this thing. We must bring in traditional leaders. We must bring in faith-based organizations. Our parents, they must parent now and make sure that they protect those children, because there's something wrong for a 17-year-old to have a child, because definitely that child was 16 years old when she was pregnant, because now she's 17 when she gives birth. Clearly there's something wrong, so we need those educational sessions that we must do to our communities. We can't be proud that we're having young mothers in our communities because they are still young, they must take care of themselves. Some are still at school, as you have heard me talking to them, that they must go back to school so that they are able to have a brighter future.
And I saw you giving in some pointers there, how to hold the baby and so on. Perhaps just going forward, what do you want to say to these mothers?
I want to say to those mothers, they must protect those kids. It's so nice as a parent to see your child developing from the first day until that child goes back to school and she becomes a mother to at some stage. So I know how is it like, and I love children. That's why you always see me on these days. I don't even get tired to come to the hospital and talk to them. Even when I visit hospitals, the first place I go to, if it's a hospital that have a PIDS unit, I go to that unit because I want to see and I want them to be protected.
And lastly, MEC, we saw you going to high care as well. Those mothers have gone through a lot.
They have gone through a lot indeed, and that's why one of the journalists was asking me why we chose this hospital. We chose it because of the best practice that doctor is doing, the first doctor that we are interviewing. And we want to spread the gospel that all of them, they must minimize the cases that we have. We have a low rate of maternal cases here at Dr. George Mukhari Hospital. So that's why we want to ensure that even other hospitals copy from them and do exactly what they are doing, of emphasizing that primary health care is key to our society.
Thank you very much, MEC, for speaking to us. I heard you there saying that you want to steal the doctor, and he was quick to say no. He wants to stay here.
Oh, he has been here for ages. You can see the number of children that he gave birth. Even the CEO studied here under the doctor. So there is no way that even the CEO will agree now that his mentor must leave. I'll be collapsing, Dr. George. And I'm still building up this academic hospital. I love it so much because it's in the rural areas. It's one of the TISH hospitals that we have, which is an academic hospital.
All right. Excitement all around. You can hear their warm welcomes to the babies that have arrived. The MEC emphasizing that it's very important to take care of those bundles of joy.
Thank you very much, Nqobile Madlala.